Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in beautiful Phoenix. Hi, I'm Dr. David Greene, CEO of beautiful Phoenix and Scottsdale. Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in beautiful Phoenix and Scottsdale, Arizona. Today I'm out on a windy day at the Tempe Town Lake, which is a gorgeous man-made lake down here in Tempe, close to Arizona State University. It's about 1 billion gallons of water, and they block it off downstream a bit, and about a year ago it burst and all the water came out of the lake, and it took them months to replace it. So now it's filled back up. You can see there's people doing crew, sailing. It's really attractive, a lot of fun. The topic for today is epidural steroid injections and the 3 ways that they are different from 20 years ago. Epidural steroid injections were invented back around 50 years ago, around 1960 or so, and they've been a mainstay in pain management ever since. Why? Because they work. They work really well. If you have sciatica from a pinched nerve in your low back, or you have radiculopathy down an arm from a herniated disc in your neck, epidural steroid injections have shown at least a 75% effectiveness rate. Now, it may not be the first injection. You may need a series of 3, but 75% is typically the number thrown out. There has been some recent research showing it might be as high as 90%. But here are the 3 ways that they are different than they were 20 years ago. Number 1, fluoroscopy. Fluoroscopy is a real-time X-ray machine that helps pain doctors be much more accurate with where the needle is going. Back about 1990-ish, they did a study looking at when surgeons or pain doctors did not use fluoroscopy, and take a guess at what the miss rate is with where the epidural steroid injection went. If you think it's A, 10%, B, 40%, or C, 80%, just pick one. All right, it's B, 40%. That's an unbelievable rate of missed epidural injections. If you have sciatica and you take time out of your busy schedule to go see a pain doctor, don't you want them to put the needle in the most accurate position possible? You know, that's a rhetorical question. The answer is yes. So fluoroscopy has taken off and become really the standard of care for epidural injections. Which brings me to the second way that epidural injections are different, which is where the needle goes. More and more pain doctors are doing what's called transforaminal epidural injections. That's when the needle goes more out the canal exit of where the nerve root's getting out of the spine. So that where the nerve root is actually getting pinched is where the steroid medication goes. And that's out the foramen, so it's transforaminal. All of epidural injections when they first started were intralaminar or caudal, but now transforaminal is more popular. And the results, I don't know if it's been shown in bigger studies, but anecdotally across the country, they've been better than intralaminar because the steroid goes exactly where it's needed. Now we have the third reason epidural injections are different. And this has come about a little more recently, but when you put a medication around the spinal canal or around a nerve root, what makes it stay there? Why doesn't it just wash away? Well, the answer is particulate matter. And that's kind of like sand. Something makes it stay there. I mean, obviously the particulate matter is much smaller than sand, but the more particulate matter that you have in the medication, the longer it sticks around. But also the higher risk of complications. So more pain doctors are using less particulate steroid medications like Celestone. Kenalog has a lot of particulate matter, dexamethasone has less, Celestone has a lot less than that. So there's a catch-22, there's a happy medium that you want to reach of having the medication stick around long enough, but not causing complication rates. At any rate, those are the top 3 ways that epidural injections have changed over the last 20 years. Check out more information on our website at preferredpaincenter.com. We have the best pain management doctors in Arizona with chiropractic, PT and rehab, interventional pain management, as well as medication management on case-by-case basis. So call us today for your appointments at 602-507-6550. I'm Dr. Greene, Preferred Pain Center. Your pain stops here.